All right, I'll tell you, a lot of us out there are getting older. A lot of us have been watching sports people get hurt and getting hurt ourselves. Well, Arizona State Orthopaedics is saying that it's kind of common, but also it's kind of where you want to make sure you're getting checked out okay. Dr. Mile here with Arizona State Orthopaedics is letting me know that I cannot be the young guy I used to be anymore.
Well, I think you can be with preparation, and even in professional athletes and weekend warriors, if they have to incorporate pre and post stretching and dynamic stretching,
okay,
they still do most of the things they want to do.
Thank you. I like to hear that, but stretching comes to point. But our topic is, of course, knee injuries, and we've been watching from the Olympics to basketball to hockey to everything going on, seeing these actual major sports guys get hurt. But let's talk about the common person getting hurt in that way.
Well, they can still get the same injuries, like the same injuries that LeBron James or Carson Palmer get, like meniscus injuries and ACLs. You can get them also. In fact, the vast majority of people that we treat are regular weekend warriors or just, not super serious athletes.
Yeah. And so we were saying, I mean, we're watching them, again, play those major sports. And for us, as you said, the weekend warriors doing things. I mean, it ranges from hiking maybe to even just getting out and playing a little pickup basketball game?
Yes, exactly. And you can have ACL ruptures from there. And even from non-contact injuries, the vast majority of ACL injuries, which we all hear is season-ending injuries for athletes, the vast majority of them are non-contact. They're actually just you planting your foot and your knee shifting just a little bit.
So, all right, and someone sitting at home right now is saying, well, I kind of wonder, I did kind of like, I got up wrong and turned, and now my knee's swollen up a little bit, and that's one of the signs there? You want to pay attention, or what are the signs?
Oh, definitely. A swollen knee is definitely a worrisome sign of a knee that before the injury wasn't swollen. Other signs they should be looking for are locking or catching. If you're trying to straighten your knee, but you get stuck, or you bend your knee and you get stuck and you just shake it off and you bring it down. Or sometimes when you walk up and down stairs, you just sort of catch it. That's sometimes a sign of a meniscus injury, not usually an ACL, but some people just have frank instability. They'll walk and they'll feel their knee shift. Then you're really worried about something we call an anterior cruciate ligament injury, which is major ligament damage.
Okay. All right, so now I got to know, what is an ACL? Because I thought that was everything dealing with muscles. Is that right?
Well, a ligament is a soft tissue that connects bone to bone. And it connects the femur to the tibia, the two major bones of the knee, and is the major stabilizer. There's other smaller stabilizers we call a medial ligament injury. That's also very common. And then when you hear an athlete saying he had a knee injury and he's out 2 to 4 weeks, it's usually an MCL injury. When you hear an athlete say, so-and-so had a season-ending knee injury, it's usually the anterior cruciate ligament, which is the major stabilizer to the knee.
Wow, that's so amazing. And that's why it's so important to come see you and talk with you about anything that happens on your body when it comes to, of course, your knees, bodies, and everything like that, because it could move into even more dangerous things.
Well, if you don't have an ACL, it could lead to one, in the rare case, a dislocation, but definitely, more damage to your knee as time goes on. We do feel that an anterior cruciate ligament deficient knee will lead to somebody with arthritis earlier than they should expect, so they have a knee replacement in their 50s as opposed to their 60s.
Yeah. So, once you come see you, you're able to get maybe back out there and doing stuff, because we see athletes come back from these, don't we?
Oh, significant numbers. Even most meniscus injuries, and a lot of it depends on what your goals are. If I have, a high school catcher and he's a senior and he says, this is my last season, we probably will try to get him through the end of the season, because I don't want him to miss this. Maybe he's not going to play in college. This is his last time being in organized sports. We try to get him end of the season, and after the season, if you have meniscus injury, then we say, well, let's deal with it now. But I don't want you to give up your senior season for that.
Yeah.
Or you've been training for some marathon for a year. It says it's 2 weeks. I said, well, we'll get you through that, and then afterwards we'll deal with the long-term solution. Yeah. So.
What about someone my age who,
which is young.
Yeah,
no, really.
Thank you,
in
doctor.
orthopedics, we're still young, so remember that.
Good. I like that. So someone like me, if I'm just wanting to really make sure I get through not having that pain consistently, that's something that's important.
With many non-operative measures we can do. We try stretching. I always emphasize quadriceps. Quadriceps is the muscle in the front of your leg that goes into your knee with four muscle groups in there, and strengthening that, stretching out, even sometimes playing with a brace just so you can get through what you want to get through.
Yeah.
And people can still be very active. Our goal is always to keep people active. Maybe not to the level that they want to be for short periods of time, but keep people being active.
So there it is. I know you're part of our Live Well program, which is great, and helping us being healthy and everything. So tell them where they can find out more.
Please go to ArizonaBone.com. That is our company website, our practice website, and we'll be able to help you on all orthopedic issues or things that prevent you from doing the things you want to do. Not even just athletes, just playing around with your grandchildren or going to Yosemite, like a long planned trip. We want to help you do those things as pain-free as you can.
Perfect. Doctor, thanks for joining us this morning.
Thank you.